Hi, I'm Brian Elliott, and I'm going to talk today a little bit about the American Health Network Foot and Ankle Surgery Fellowship. The first question is, why do a foot and ankle fellowship versus already, doing a residency? The first reason that I would say it's important to do a fellowship, if it's available, is it gives you different diversity in surgical options. In our fellowship program, we have 8 attendings and 1 fellow. All of us were trained, or most of us were trained at different facilities across the country. I think sometimes in residency, a lot of the attendings were trained at the residency, so you end up getting a kind of a one-sided view of how to practice foot and ankle surgery. And in a fellowship where you have attendings that are from have a wide range of backgrounds and interests, I think it definitely brings diversity. Certainly it brings diversity on a national level to one area. I do believe that in many cases we learn as much from the fellows as we teach the fellows. We've had fellows, say from the Kaiser program. We've had fellows from the Midwest, from the South, and when they come to this fellowship, in many cases they've learned better ways to do certain techniques, and so I think that working that into one program is really helpful. A fellow gets a perspective, maybe a West Coast perspective on a certain procedure, but maybe an East Coast or a Southeast perspective on a different procedure, and I think that's it's very important. The next reason I think it's important to do a fellowship is it reduces the learning curve. They say in practice it takes 5 to 8 years to get comfortable and really figure out what you want to do in your practice. I think most people, when they come out of residency, feel like they pretty much know everything, and what I've learned is that you can really never stop learning, and so I think that a fellowship reduces the learning curve. It takes that 5 to 8 years, and fellows, when they come out, they've completed their residency, and then they've gotten an extra year just to kind of look at, okay, what do I want to do in my practice? What makes sense to me? And so when a fellow comes out, they've really kind of honed in where they want to be, and I think it takes that 5 to 8 year mark and really cuts it down. I think a fellow is much more ready to practice when they're done. I also think that when we train, you have one chance to fill your toolbox, and when you're a resident, you're trying to learn as much as possible. You want to put as many tools in your toolbox as you can. Certainly your first few years of residency, you're certainly just trying to get your feet under you, and a lot of times by the 3rd year people are starting to become very proficient, and certainly residencies are doing an excellent job training people and training these young foot and ankle surgeons. But I think if you look at what happens in a fellowship, it's very different. You already have a lot of tools in the toolbox. You're basically just trying to add extra, and you're adding extra of what makes sense to you, and I think that that's really important. This fellowship is heavily weighted on self-motivation. I think you can tailor your experience here, based on what your interests are. Certainly there's a number of us that do high volume, reconstruction, a lot of revision reconstruction, trauma. There's some of us that are very interested in, say, external fixation or total ankle replacement, and so different attendings here have different passions, and I think that that's good because you can, every fellow can gravitate towards what their passion is, and I think that that's very helpful. The other advantage of being a fellowship's much different in my mind than a residency, in that, residents are kind of the workhorse of the hospital. You're doing lots of dictations, lots of paperwork, and a lot of extra work, whereas I don't think that's a fellow's job. In my mind, and I think really the philosophy of all the attendings here at this fellowship have the same mindset, that a fellow is here to learn. We don't get any financial benefit out of having a fellow. We do this purely to give back to our profession. The attendings at this fellowship are too geographically spread out to have one central location where we could run a residency. And we wanted to give back to our profession. That's why all of us came together and decided to do a fellowship. So we don't have the fellows do paperwork or dictations. It's just not what we need the fellow to do. We need the fellow to go in on different procedures, to give their opinion, maybe share their insight, and try to help us exchange information. For instance, Dr. Blackledge and I practice an hour apart, and we don't see each other every day, so a fellow's job is to be a conduit between us to help exchange ideas, and it's really helpful not only for us but for the fellow as well. So again, you're not here to be a workhorse. You're here to learn and to help in the exchange of ideas and try to make our profession better. It's interesting here, different physicians have different interests. For instance, Dr. Perler is very interested in total ankle replacement, as is Dr. Blackledge. My primary interest would be arthroscopy and trauma. Not that I don't have interest in these other things, but certainly Dr. Miller is an incredibly efficient surgeon, and certainly a fellow learns to become very fast, very efficient, while working with Dr. Miller, and certainly Dr. Lyons, Riley, Winters, Masada, everybody has different interests, and so I think a fellow can gravitate towards what their specific interest is, and they can really tailor their experience here. I hope this helps, and certainly I would encourage anybody that has questions to feel free to contact any one of us. Thank you.